In this video, we're going to talk about a very important topic: seasonal childhood illnesses. Do you know what these illnesses are and how to prevent them? Stick around until the end of this video, and I'll explain everything to you clearly and concisely. Seasonal illnesses are those that occur more frequently during certain times of the year, depending on the climate and people's habits. They can affect both adults and children. But little ones are more vulnerable because their immune systems aren't fully developed yet. There are several seasonal illnesses that can affect children, but today, I'm going to discuss the 10 most common ones and how to prevent them. The first one is allergic rhinitis, which is an inflammation of the nasal mucosa that causes sneezing, a runny or stuffy nose. It's more common in the spring due to pollen from flowers, which can trigger allergies in those predisposed. To prevent allergic rhinitis, it's important to maintain nasal hygiene in children, avoid dust, mites, and animal fur, and use saline solution or anti-allergic medications as recommended by a pediatrician. The next is chickenpox, which is a contagious disease that causes red blisters on the body. It's transmitted through contact with the saliva or secretions of infected individuals. It's more common in spring when the virus becomes more active. To prevent it, it's essential to vaccinate children against the disease, which is part of the national vaccination schedule. Additionally, it's important to avoid contact with sick people and to thoroughly wash hands and objects that children use. The third is the common cold, which is a respiratory illness caused by various types of viruses, resulting in a stuffy or runny nose, sneezing, and a sore throat. It can occur at any time of the year but is more common in winter, when people gather indoors and the air is drier. To prevent the common cold, it's important to keep children hydrated, offer foods rich in vitamin C, and avoid contact with sick individuals. The fourth is the flu, which is a respiratory illness caused by the influenza virus, leading to fever, cough, sore throat, and muscle pain. It's more common in winter when the virus becomes more resilient. To prevent the flu, it's crucial to vaccinate children against this disease, which is also part of the national vaccination schedule. Additionally, it's important to avoid contact with sick people and to thoroughly wash hands and objects that children use. The fifth is bronchitis, bronchiolitis, and asthma. Starting with bronchitis, it's an inflammation of the bronchi, which are the larger airways in the lungs. It's usually caused by viral or bacterial infections, resulting in coughing, mucus production, and wheezing. Now, bronchiolitis is more common in babies and young children. It affects the smaller airways, the bronchioles. It's typically caused by viral infection, especially respiratory syncytial virus or SV. Symptoms include coughing, wheezing, difficulty breathing, and sometimes fever. Lastly, we have asthma, a chronic condition that affects the airways. It can be triggered by allergens, infections, or even physical exercise. Asthma causes coughing, wheezing, chest tightness, and difficulty breathing. They are more common in winter when the air is drier and colder. In the case of bronchitis and bronchiolitis, prevention involves maintaining good hygiene, washing hands, and avoiding contact with sick people. Treatment usually includes hydration and, in some cases, medications for symptom relief. As for asthma, prevention involves avoiding known triggers like allergens and irritants. Asthmatic patients may need daily control medications, as well as quick relief medications for crisis situations. Next, also related to bronchiolitis, is respiratory syncytial virus or SV, which is a virus that causes severe respiratory infections in children, especially premature babies. It leads to coughing, chest wheezing, and difficulty breathing. It's more common in the fall and winter. To prevent RSV, it's important to avoid contact with sick people and to thoroughly wash hands and objects that children use. The seventh is gastroenteritis, which is an intestinal infection causing diarrhea, vomiting, and dehydration. It's caused by viruses, bacteria, or parasites found in contaminated food or water. It's more common in the summer, when higher temperatures favor the proliferation of microorganisms. To prevent gastroenteritis, it's important to offer filtered or boiled water to children. Wash foods thoroughly before consumption and avoid consuming raw or undercooked foods. More active in the summer, the ate is hand, foot, and mouth disease, which is a contagious disease caused by the Coxsackie virus, resulting in blisters in the mouth, on the hands and feet. To prevent the disease, it's important to avoid contact with sick people and to thoroughly wash hands and objects that children use. The ninth is ear infections, which are inflammation of the middle ear caused by bacteria or viruses, resulting in pain, fever, and discharge. It's more common in children under 3 years old and can be associated with throat infections, the flu, and colds. More incident in the colder months. Ear infections cause various other symptoms besides intense pain, fever, loss of appetite, difficulty sleeping, nausea, and, in some cases, fluid discharge from the ear. If you suspect an ear infection, take the child to a doctor as soon as possible. Treatments with antibiotics or anti-inflammatories recommended by a pediatrician are often effective, and analgesic drops can be a good option for pain relief. And the 10th is rubella, measles, and mumps, which are contagious diseases caused by viruses resulting in fever, skin rashes, and inflammation of the salivary glands. They are transmitted through contact with saliva or secretions of infected individuals. They can occur at any time of the year, but are preventable through vaccination. As you can see, these are some of the seasonal childhood illnesses that can bring a lot of discomfort to children and their parents or caregivers. Therefore, it's essential to prevent these diseases by following some simple yet effective measures. Vaccinate children against vaccine-preventable diseases, following the national vaccination schedule. Maintain personal hygiene in children by thoroughly washing hands with soap and water or using hand sanitizer before meals and after using the bathroom. Thoroughly clean objects that children use, such as pacifiers, toys, and bottles. Avoid contact with sick people or those with symptoms of respiratory or intestinal infections. Offer filtered or boiled water to children and avoid consuming raw or undercooked foods. Ensure children's hydration and offer a healthy diet with fruits, vegetables, and foods rich in vitamins and minerals. Prevent children's exposure to cigarette smoke and other pollutants that can irritate the respiratory tract. Seek a pediatrician whenever children have fever, pain, discharge, or any other warning signs. These are some tips that can help you protect your children from seasonal childhood illnesses, but remember, information is the best form of prevention. Therefore, always pay attention to the guidance of healthcare professionals and reliable sources of information on these diseases. Share this knowledge with others who may benefit, and remember to take good care of your little ones and yourself. If the video was helpful in any way, please don't forget to like, subscribe to the channel, and hit the notification bell to receive updates on future channel content. The sources used in this research are listed in the video description.